Our next guest this evening is Barbara Pachecko, a 61-year-old woman who was recently diagnosed with breast calcifications. She is unemployed and uninsured, and she would like to share her story. Barbara.
Hi all, and thank you all for coming out. You're an inspiration. I found myself recently unemployed. About 4 months ago, I did lose my job. It could be any of you. It could be you. It could be you. It could be you. It is you. When you're unemployed, what do you do? What do you do to cover your health? Well, I had to go out and seek. Luckily, I had a computer. I went online. I looked around. And I found some places where women can get some free health care. However, you cannot have anything in the bank. You have to be totally broke. So there really aren't alternatives for us once we are unemployed and uninsured. So recently, about a few weeks ago, I did have a diagnosis of some incident in one of my breasts, and I was very scared. I thought to myself, well, I'm going to be wiped out. I'll have no money. I have no job, no health insurance. What do I do next? So I did seek out some places, and the happy ending to this story is that I am getting that free care. But you do have
to right.
Fight, fight, fight.
Healthcare is a right.
Fight, fight, fight.
Healthcare is a right.
Fight, fight, fight.
They say get back. Yeah, I'm looking for the veterans in the crowd now. They say get back.
We say fight back.
They say get back.
We say fight back.
Get back.
Fight back.
Get back.
Fight back.
Get back.
Fight back.
Okay, give yourself a hand. Give yourself a hand. Next up, we'll have Ajamu Sankofa. He's a former staff lawyer and director of the AIDS Project of the National Prison Project of the ACLU Foundation. Ajamu is currently a member of the National Association of Black Lawyers and is a founding member of the Private Health Insurance Must Go Coalition. Let's hear it for Ajamu!
Are you sick and tired of being sick and tired? Are you sick and tired of being sick and tired? Are you sick and tired of being sick and tired? What the hell is that?
Bullshit.
What the hell is that?
Bullshit.
That's the scene of the crime. Look how tall it is. Look how big it is. Y'all, I don't want to fall down here, but look how big and tall that thing is. That is like a scalpel cutting out the hearts of the people living in this country. They deny people health care and make billions of dollars as a result of it. Are we going to stop it?
Yes!
Are we going to stop it?
Yes!
Now there is a myth out here. There is a myth out here that's being propagated by them and the minions they pay for. They say that the time is not right. They say that the politics are not right. They say that there's not a groundswell of support for a single-payer national healthcare system where healthcare is a human right. Well, you know what? They are damn liars! There are people all over this country today doing exactly what you are doing. Standing up for their right. Standing up for their basic human right to say, I am sick and you're not going to privatize my care. My care is the duty of civil society, and it's our duty to make sure that we win. And there's nobody else on earth who's going to do it but us. Do you hear me? It is not Barack Obama. It's not Hillary Clinton. It's not some expert. It is us on the streets demanding that we have health care as a human right. And we must do this on a daily basis. This march was wonderful, but it must not be a sheep march. You hear me? It's not an episode that we do today and go away. It must be a sustained effort to rock the boat, to topple this shit. You hear me?
Yes.
We need to topple this shit. And the time is no longer the time for tentative language.
No.
They are criminals.
More criminals.
No, it's not enough to say it's a violation of human rights law. They are criminals. They are killing my 84-year-old mother. You hear me?
Yep.
and the mothers and brothers and sisters all over this nation. And they're saying, claim denied, claim denied. Our task is to make everybody in this country a critical mass angry enough to stand up to what they believe is right. You know, it's a kind of a schizophrenia. I know this is wrong, but there it goes. I know this is wrong, but there's no courage. There's no belief that we can win. And we must instill in ourselves the belief that we can win. And you know how we do that on a daily basis? Every time you go to a meeting, bring 1 or 2 more folks with you. This is your organizing duty. This is your organizing work. Because in numbers there is strength, and in numbers there's a sense of safety. And the biggest political weapon we have is the expectation of victory. The expectation of victory. Yeah. Let's instill that on a daily basis in the way we organize. I'm a member of PHIMG, Private Health Insurance Must Go Coalition. There are members of Healthcare Now here. There are members of the New York Chapter Physicians for National Health Plan. There are other organizations here working very hard. Join them. Up the ante. Up the ante. Yeah. Up the ante. Yeah. I am sick and tired of being sick and tired. Yeah. And you know what? We're going to win. Yeah. We're going to win. Are we going to win? Yeah. Are we going to win? Yeah. Are we going to win? Yeah. The private health insurance industry must go. Yeah.